Excited to be speaking with you today. I'm going to be giving a brief overview of what ACWA JPIA has had in place for the past several years. I'm going to give you a general overview of what is Carrum Health, what it is that we do, and then I'll be passing it over to my colleague, Deirdre, to review our new cancer care offerings as of 1/1/2023 for you all, as well as your eligible dependents. So she'll be going over to that into more detail and really taking up the bulk of our 45 minutes here together. And then we'll have some key takeaways for everyone on the call, some next best steps on how to best engage with us. Okay. So Carrum Health is a special medical and surgery benefit that is sponsored by ACWA JPIA. And our goal over at Carrum is to make it easier and less expensive for employees to get the best care from world-class doctors at high-performing hospitals and facilities that we call Centers of Excellence, or COEs, which you may hear us refer to them as, when employees need certain planned non-emergency surgeries. And as Jackie had mentioned, this program is voluntary, meaning that employees have the choice to get care through us or through their in-network medical carrier provider. And we believe that ACWA JPIA employees deserve a better medical experience and will help connect you all, as well as your eligible dependents, to the right care and the right providers. So who is eligible for Carrum? As Jackie mentioned, these are for employees and dependents 18 years and older enrolled in an Anthem PPO plan, as well as the CDHP plan for those in HSA eligible plans. Okay, so what is covered? Here you'll see that Carrum covers over 100 different types of non-emergency surgeries. This is for musculoskeletal, spine, heart, and weight loss surgeries with a recommendation from your local provider. So for musculoskeletal surgeries, these include anything having to do with your bones, muscles, ligaments, or tendons, such as hip or knee replacements, shoulder surgery, as well as surgeries including ankle and wrists. We also help with spine surgeries like spinal fusions and laminectomies, and then heart surgeries like coronary bypass surgery and valve procedures. And then lastly, bariatric weight loss surgery. And these procedures have been available for some time to ACWA JPIA members, as well as their eligible dependents. However, as I mentioned, we have a new offering for cancer care treatment and guidance, which my colleague Deirdre Soleil is here to present. She is our Market Vice President of Oncology over at Carrum Health. She has a PhD in immunology and has spent years researching cancer care, making her our go-to expert for Carrum's oncology program. So I'm really excited to introduce her, and she's going to be diving into what's new for ACWA JPIA this year.
Oh gosh, Emma, that was a flattering introduction. Hi, everyone. Please feel free to call me Dee. I am joining you from the East Coast, from Richmond, Virginia. And honestly, I'll thank you so much for taking the time. I'm just so excited, honestly, to talk to you about what we're doing in the cancer care space, just in case, right? Something happens, you, a loved one, you know, a colleague, ever needs this benefit. So I'm going to start with what is probably a very obvious statement, but let's just say it anyway, and that is that healthcare is really confusing, especially if you or someone you know, someone you love has ever needed cancer care. It becomes incredibly confusing, really overwhelming, really quickly. The good news, right, is that we have made tremendous progress in the field of treating cancer care, but it is super specialized. It is really complex. It can often be pretty darn confusing. And when we think about a cancer diagnosis, right, it really impacts the entirety of someone's life when they're dealing with it. So when someone hears that diagnosis, a ton of questions may pop into their head. And as they go across the weeks or the months of treatment, new questions might continually arise. And you see some of those questions here, right? So first off, how much is this going to cost me, right? How do I find the best possible cancer care for my specific tumor type? How do I know that this treatment's the best one for me? Also a lot of, right, how do I talk to my children, my partner, my parents about this? Is this going to impact my ability to work? And then I think perhaps most importantly, and really tough to answer, right, is how are you going to find someone who treats you with the compassion and the respect that you deserve, right? And not just like another number. Again, there are a million questions and concerns that might arise across someone's experience with cancer. And that's really why our goal is to make dealing with a diagnosis of cancer as easy as humanly possible. And listen, I get it. Like, we're never going to be able to fully take away the stress, you know, the burden, the sometimes fear that might come with cancer, but we want to take away as much of that as we can. So just at a very high level, I'm going to come back to this slide a couple of times. Please do not feel like you need to memorize any of this, but here are the different programs we offer on our platform that y'all have access to. And they are our guidance program and our treatment program. I'm going to go into these into more detail, just so you get a feel, right, for some of the options available. But at a very high level, here's what they are. For guidance, this is a virtual service you can access from anywhere, right? So any cancer diagnosis, and it is going to give remote support from some of the best oncologists in the world, as well as ongoing virtual support from cancer specialized staff. They're going to help answer questions, you know, address other concerns, other issues that might pop up. Now, treatment, and again, we'll talk more about these, but this is limited for now to some patients who are dealing with a non-metastatic breast cancer diagnosis. So this means if someone needs to receive treatment for breast cancer, let's say I need surgery and chemotherapy and radiation therapy, you know, I could be eligible to receive that through this program. Again, I'll cover more about this in a second, but what I really want you all to take away is that if you or one of your eligible dependents is facing this, please, please, please don't hesitate to reach out to us so we can work with you, right, to explain this and to figure out the best option for you. Okay, so with that, you might be wondering, well, Dee, how do I get in touch with you? And probably the easiest way is to register through our mobile app or web. You can also always pick up the phone and call us. Before we sign off today, we'll leave you with all of our contact information. As Jackie said, we'll post these slides online so you can reference that as needed. And when someone calls us, we'll gather some basic information, right? So we'll want to know, you know, what kind of cancer is it? Is it breast cancer, prostate, lung cancer? And also, what is this person looking for, right? Like, how can we help? And we built our program so that anyone who comes to us with a cancer diagnosis gets to a human being ASAP. This is an extraordinarily stressful time for folks. So we want to get them to a human who can provide some answers about their care. And these humans are our dedicated care navigators. In short, as you can see on this slide, they are available to answer your questions about the benefit, right? To sort of cover the details about what's included. I think most importantly, they're also going to explain the program that's available, right? So is it guidance? Is it treatment? Is it something else? And they're then going to connect that person to that center of excellence, that facility, and be an ongoing point of contact should anything else arise across the journey. They also will be able to help people understand how much, if anything, they'll have to pay out of pocket. So again, whenever you have a question, you know, you can message us, message your care navigator anytime using our Carrum Health mobile app, or again, pick up the phone, speak with them directly. I think the biggest benefit, as you can imagine, this team is super specialized and they are wonderful. And it really is they're a great resource. They can really help our patients rest easy, you know, knowing they're going to be there to help them every step of the way, help coordinate care, help advocate for what people may need. Okay, so I'm going to go back to this slide And again, you don't need to memorize this because care navigators, should you ever need it, are going to help you figure out what's available, what's best for your circumstances, right, for what you are looking for. But I do want to highlight what's available in each of these programs really quickly. So let's start with our guidance program. And this is, remember, regardless of where a person lives, what type of cancer they have, whether it's prostate, it's colon, it's lung, it's ovarian, or where that person is in their journey of treating cancer, right? So whether they're at the very beginning and just got diagnosed, whether they've had surgery, whether they're in the middle of chemotherapy, this is still an awesome service for folks to tap into. And this is because this benefit provides them with virtual access to not just one oncologist, right, but really to an entire team of expert care specialists from some of the top hospitals, cancer-dedicated hospitals in the country. Now, I will say, in my opinion, let me state that, but as Ava said, I've worked in this space for a really long time, and I do think that one of the most valuable things anyone can do when they have a cancer diagnosis is to get an expert advisory review. Now, you might have heard the term second opinion. That's what this is. When I say expert advisory review, that's sort of what this is, but on steroids. And truly, for everyone I know, and anyone who's ever reached out to me when they get a diagnosis of cancer, I always tell them, please go get that second opinion, get that expert review, because that is going to make sure that they have the right diagnosis and they have the best treatment plan for their situation. So really, it can only help. And this might just end up validating that, like, yes, I'm on the right path. It also might change my diagnosis, or it might change the treatment I receive to make it more tailored to my specific body, right? My biology and my preferences, and ultimately give me a better quality of life or give me a better outcomes. So again, I'll just say in my opinion, my piece of advice, if you're ever debating if you or a friend or family member should get that expert review, please do it, right? You can, of course, do it through us. It's covered under this benefit, but really just do it. I think it's so worth it. Your original doctor is not going to be mad at you. It's really only going to help make sure you're getting the best care. So if I enter this guidance program, these specialists are going to be available to provide me with their expert opinion on my diagnosis and on my treatment plan, right? So they're going to make sure, yes, Dee has the right diagnosis, her treatment plan looks right for her. They are also available to work hand in hand with my local cancer care team, and they are available to provide them with their expertise, some of the latest insights into innovative cancer research and cancer treatments. The really great thing about sort of the oncology space, the cancer space, is that cancer really is a team sport. So a lot of oncologists will welcome that support. There's a lot of collaboration that happens to make sure people are receiving the latest and greatest in cancer treatment. And this is a great, great way to help foster that collaboration. Now, I do think, even better in my opinion, this is not sort of a, one and done. You have access to the support for 2 years, right? So as someone's treatment, someone's disease might change, even let's say as someone's treatment ends, right? So they've ended active treatment, they go into what we call, we might call survivorship. They'll still have access to this virtual support from these highly trained oncology doctors, coordinators, and nurses to help answer any cancer-related questions. So again, that was a lot of talking on my part. I'm keeping an eye on the chat. So, let me know if you have any questions. But I think just bottom line for y'all to take away with this sort of virtual guidance bundle is, again, no matter where someone lives, no matter what type of cancer they're dealing with or diagnosed with, they can access an entire cancer team and the support system virtually across their journey.
And Dee, I'd like to just make a shout out that the guidance program is 100% no cost for the patient. Is that correct?
Yes, Jackie, such a good call. Yes, it is covered under this. And so again, I just think there's just so much value to be had in something like this. Everyone, I truly believe that. And I really am not lying when I say I recommend everyone I know get this sort of level of support, and the fact that you don't have to pay out of pocket for it's really incredible. Okay. Great call out, Jackie. All right, let's go into the treatment program. Now, for right now, specifically for folks who may live in Southern California, in the greater Los Angeles area, they may also be eligible for comprehensive cancer treatment for breast cancer at the City of Hope. If you haven't heard of City of Hope, they are a top super subspecialized cancer hospital. Their headquarters are in Duarte, but they have, as you can see here, hopefully you can see it pretty well, these different maps. They've got locations, other locations across the area. Now here, for our comprehensive treatment program, this includes that same, right, expert review. They'll make sure diagnosis is correct. They'll create a personalized treatment plan that fits that person's needs. And so let's say that person may need to receive surgery. They may need radiation therapy. They may need chemotherapy. All of that's covered. They'll also receive total comprehensive support, including symptom management, nutrition or dietary support, as well as access to support groups, if that's what someone wants. And honestly, a whole lot more sort of other services that they provide. So again, you can see the locations called out here. You know, I will say, and I'll put myself on the line with all of you, it really is my team's job to sort of build out more access points. So hopefully when we're talking to you next year, I'll have a map full of access points. It is limited geographically for now, right? Because we don't want folks driving in really long distances every single day for radiation therapy, right? You might have to go in every day for 5 weeks. We don't want folks driving, you know, over 60 miles to come in for that. Same thing with chemotherapy. So limited geographically for now. Even if you don't live within driving distance though, you may also be eligible for travel benefits for surgery specifically. So again, no need for you to remember to memorize all of this. Our care navigators really exist so that if you are ever dealing with this diagnosis, right, they will help you understand your options and they'll help you understand what's available to you. Okay, now City of Hope is our partner in California for now. They are tremendous. And as we add new hospitals and facility partners across the state, you can rest assured that they really are the best of the best. So here's a little peek behind the curtain of what my team does really every day. We actually just got off the phone where we were interviewing a cancer program because we do a really thorough evaluation, right? We want to make sure folks are receiving best in class care. So we evaluate all of our provider partners based on a number of quality metrics, and that might include patient satisfaction or patient feedback. You know, do they provide care that's based on evidence and national guidelines for cancer care? You know, how do they help manage treatment symptoms and side effects like nausea or fatigue? We also do an in-person assessment, what we call a site visit, to really understand what the experience is going to be like. So, you know, we physically travel to these places and really see and experience the journey for ourselves, from how someone parks and enters the building to coordination of care to, again, all those different support services they might offer, like nutrition, social work, yoga, or exercise, salons, and boutiques, and support groups for family members. And I think it really is, you know, because of this, because we put so much time and energy into selecting our COEs, it is because truly we believe that you deserve the highest quality care and the best experience possible. You know, and we receive tons of feedback like this from members who have gone through our program. So you can see for this patient, you know, the Carrum Health team helped me navigate the cancer care process, and I had an answer in 2 days. As a result of this benefit, I had additional support prior to my surgeries and reduced financial expense. I have now completed my treatment plan and have a great prognosis. As I return to work, I wanted to share with you what a difference having such a thoughtful and curated benefit offering means to an employee at their time of need. Really, I will say, I think this slide probably sums up best why I came to work for Carrum. We are really confident, if you choose Carrum, if you're ever facing this diagnosis, you too will experience world-class care. And really, it's the way we think all healthcare should be delivered in this country. Now, as I mentioned before, if you do have any questions about what's covered, what out-of-pocket cost could look like, what the next steps are, you can visit our website or you can download our mobile app. From there, you can immediately and securely message our team. You can get connected with a dedicated care navigator, scope out what providers are close to you, and really just get step-by-step instructions to help you prepare for next steps in your journey. And again, if you do not feel comfortable using our Carrum Health app, you can always just give us a call and we'll be happy to assist you over the phone. So here is sort of all of that contact information. You can see your dedicated webpage here. You can always feel free to go to that. And you can always use our number here as well as our app. So please, please, please do not hesitate to reach out. We will be here for you and really just want to take off as much burden as we possibly can for everyone who needs musculoskeletal care, all the things Ava called out, as well as anyone dealing with a cancer diagnosis. So with that, I'm take a breath. I feel like we went through pretty quickly. I'm going to check chat. Jackie, I saw you come off mute. So any questions you were seeing or any questions in your head you want to share with the group?
Well, I haven't gotten any questions yet, and I think the presentation has been really informative, so thank you. I did want to do a quick pause and sort of a little bit of a deeper dive. I don't know if we have any consumer-driven, Anthem consumer-driven health plan with HSA participants on the phone or on the webinar, but I did want to just make sure that it was clear that if you are on the CDHP with HSA plan through Anthem, through ACWA JPIA, guidance, once again, is completely free. It is exempt from that CDHP deductible. So not only the Anthem Classic PPO and the Advantage PPO people who don't have the deductible like that, but also the CDHP folks, that guidance program is exempt from that CDHP deductible. When it comes to the breast cancer treatment, when it comes to the surgery for that, it would be like the other Carrum surgery program where you do have to satisfy your CDHP deductible as part of the program if it's not already satisfied. Typically, when someone is going through something like this, they've already had quite a few medical expenses, so more than likely the calendar year deductible has already been satisfied, but if it's not, then that would have to be part of the financial consideration as well. So just wanted to point that out. Thanks.
Thank you, Jackie. It's a great point of clarification.
Was that our last slide, or we do have a question. Okay, the deductible, what's the deductible on the Anthem CDHP? So the Anthem CDHP has a $1,500 individual deductible and a $3,000 deductible for family. And that's regardless of what type of diagnosis that you have, non-cancer, cancer, surgery, sinus infection, whatever. So hopefully that answers that. Does anyone have any questions? Please feel free, if you're comfortable, to unmute if you have a question, or send it through the chat, either as a direct message or to everyone if that's okay with you. And once again, we are going to send the link out to this presentation to the HR contacts at all of our water agencies who are in our Anthem plans, so that they can then share it with their employees, anyone who might have missed this. So Dee, do you have any other great success stories that you can tell us about? I know this program's really kind of fairly new with Carrum right now, but Do you have any great success stories or anything like that that you can share?
Yeah, Jackie, it's such a good question. And we really do. I mean, it's pretty stark. And it's why I sort of spent a little bit more time talking y'all's ear off on that sort of virtual guidance page about the benefits of having that expert advisory review. Because truly, I think that is just so important, right? And every oncologist, they're doing what they think is best, right? They're doing the best for their patients. But right, things change. People have different opinions. Treatment evidence on treatment and outcomes is evolving really quickly in cancer care, which we are really lucky. But there are new studies, new results coming out all the time. And we actually were just recently talking about a patient who had sort of been given a treatment plan. It was the diagnosis of breast cancer, given a treatment plan. It was going to include a double mastectomy. So it was going to remove, right, both breasts, to remove the tumor in one breast, and then sort of do what we say, like proactive on the other side. And there was a lot of hesitancy. They did not necessarily want that, just wasn't really into like full surgery. Do I have to do this and think about reconstruction? So they came through our program in that virtual guidance program and wanted this expert advisory review, right? Like, is this, because that's where it really comes in so valuable, right? Talking to these experts who think, breathe, live, in this case, breast cancer, all day, every day. And they said, sure, you could do that, but actually what we would recommend is we do a smaller surgery, a lumpectomy, and we do radiation therapy. And then we surveil you, because that's what it really seems like this is. This doesn't seem aggressive, invasive. This person was hugely pleased, like so excited that they wouldn't have to sort of go through that, all of those procedures, all of that care, but relatively, a less invasive care. So that was wonderful. I'll also say that person, and then that person actually, because of that, was able to go in person for their care. So then I actually switched into that treatment program that I talked about. So it was a real success story that just happened that we were thrilled to hear, because that person is just so excited, so happy. It's such a relief for them. And then the other piece of that, which not to become use all the utilization, but that person also needs a lumbar surgery. It's like, oh, I can't wait to use Carrum for my spine surgery in the future. So that was a very just great story, worked out best for patient, for family. It's a really important one.
Great one. That really, I think the personal stories are very helpful to people that trying to understand this benefit and what it really means. I mean, on my own personal story, my mother had multiple myeloma. She was diagnosed way back in 1989. And at that time, we lived in Houston. And so she went to MD Anderson, which is a big cancer. It's one of the biggest in the world. And if only she had access to this guidance program, it probably would have made an absolute world of difference, because one of the key things that I know about someone going through cancer is they need an advocate. Yes. It is really, really hard to advocate for yourself when you're in a scary, stressful situation and you're being thrown into a world that you've never been in before. And just being able to have someone you can call and just, hey, explain this to me. Is this right? Am I doing the right thing? Probably would have meant that she would have had far less stress throughout her experience with that, that many years ago. So just based on that, I would recommend, if anyone is experiencing cancer and they just don't have enough advocates in their life, this is a really great program.
Jackie, thank you so much for being willing to share that. Because yeah, you're so right? The burden gets put on so many folks. So I'm sure it was on your mom, it was on you to figure out how these pieces connect, who to talk to, where to go, how to run around and get the appointments. It's so much work. And again, we can't take all of that away, but our goal is how do we take as much as that off of people and their families, just let them focus on getting better. And you're so right too. I know every medical specialty has their own language that is truly a completely foreign language. In oncology, and especially, Jackie, multiple myeloma, any of those, blood or hematologic cancers, mm-hmm. It's a whole other language. You're like, how the heck are people understanding and supposed to make sense of this? And it's so critical to have that advocate, sometimes too, right, that sort of interpreter or translator to make sure the treatment that people are getting or the care support that they're accessing is what's best for that person and aligns with what they want, right? Because often it's hard to speak up and say what we need, or we don't know what we need or want. So really thank you for sharing that, because I think so many folks go through that. And I really, really, really think, to your point, especially that sort of guidance program is just that ongoing support when you need it.
Yeah, absolutely. I think this is probably one of the most valuable things that we've ever implemented. So I really, really appreciate you guys coming on today and explaining all of this so much more, so much better than I do. So I appreciate it. I think unless we have any other questions, I'm going to shut up for a second and see, does anyone have any further questions or any further chats? And if not, then we'll go ahead and call it a day on this, I guess. And I don't see anybody unmuting. So I guess we'll call it a day. And thank you again, Dee and Ava, so much for all of your help with this. And again, we will be posting, we'll be posting the link to this presentation, as well as sending it out to the HR contacts. And also we'll be sending out the slides as well. So you can look for those in about the next week or so. But for now, we'll just say goodbye and thank you again.
Thanks so much, everyone. Take care.
Thank you.
Thank you.
Have a great day.
Bye-bye.